Dr. Lawrence Sperling. I'm a preventive cardiologist, a practicing cardiologist at Emory University in Atlanta. I also serve as the executive director of the Million Hearts Initiative, and so we're here today to talk about a really important area of focus and an area where there's been a fair amount of confusion. In fact, many of my patients are asking me questions about whether aspirin's appropriate for them. We know that aspirin is an appropriate strategy for heart disease and stroke prevention among those living with known heart disease or people that have had a prior stroke. It can reduce the chances of a second cardiovascular event in those that have had a bypass surgery or a stent. We consider those that have had a prior heart-related event or a stroke a high-risk population. And in this high-risk population over the next 5 years, the chances of a second heart attack would be about 1 in 5, or a second stroke about 1 in 4. This would be a clot-based or ischemic stroke. Thankfully, aspirin can reduce the risk of a second event in this population, reduce the risk of a heart attack by about 30% in this population, and reduce the risk of a stroke by about 20%. Aspirin's a medication, and aspirin's mechanism of action is that aspirin reduces the stickiness of platelets. Platelets are cells within our bloodstream that, if they clump or come together, can form a blood clot. So aspirin reduces the chance and is helpful in reducing a potentially harmful blood clot in our blood vessels. We know that aspirin is a medication, and so you should be talking to your doctor or your clinical team about whether aspirin is appropriate for you. If you're presently taking an aspirin, don't stop the aspirin, but readdress this question or address this question with your doctor or clinical team. Medications can have benefits, but they can also have risks and side effects. When we think about appropriate aspirin use, this is part of a comprehensive strategy for heart disease and stroke prevention. As I mentioned, I'm a practicing cardiologist, but I also serve as the executive director of the Million Hearts Initiative. Million Hearts is a national initiative focused on the possibility that we can prevent 1 million heart attack, strokes, and cardiovascular events in our nation through the implementation of proven and effective strategies such as appropriate aspirin use. To learn more about Million Hearts and appropriate aspirin use, go to millionhearts.hhs.gov.